his research several years ago and producing a book from it talked about the brain's executive functions. And in his research, he looked at children, adolescents, and adults. And he found that there were approximately 6 behaviors that those people with ADD simply had more difficulty carrying out. They are they're the behaviors necessary for what we call cognitive functions, and those would be things like thinking, reasoning, planning, prioritizing, and organizing information as it comes into the brain. What he found was 6 areas: activation, focus, effort, memory, emotion, and action. Were 6 areas that were necessary for cognitive functions, but in people with ADD tended to have a lot of difficulty in these areas, and in fact they tended to overlap. The areas he found were chemically based in the brain. And one of the interesting phenomena was that when the brain was interested, or the student or individual felt a strength in that particular area, the cognitive functions worked, and there were no signs of the ADD. So again, his feeling that, from his research, that it was a chemical reaction, and interest played a very, very significant part in whether or not ADD symptoms show up, which of course for those of us who work with adults has great implication in terms of, as we were talking about, contextualized learning, that is highly relevant, important, and very motivating to a student, becomes really, really crucial with someone who is ADD. Also, recognizing when a person is feeling frustrated and emotions override attention, very important. So these are the kinds of students who may have the capacity to learn, but those tasks, the organizing, prioritizing, memorizing, reasoning out things, that become difficult because they're totally disinterested, or they become frustrated, really need to be addressed, because this is these are the characteristics of attention deficit.